Welcome everyone, and thank you so much for joining us for Partners in Pain. My name is Susan Tupper, and I'm going to be facilitating tonight's session. So thanks again for joining. So just before we get started, I wanted to acknowledge that I'm in Saskatoon. I know people are kind of all over the province, but where I am is Treaty 6 territory. And this is the traditional territories of numerous First Nations, including Cree, Dene, Nakota, Saulteaux, and Ojibwe people, and homeland of Métis nations. So wanted to make sure we pay our respects to the First Nations and Métis ancestors, and to make sure that we reaffirm our relationships with one another. So just a little bit of background about Partners in Pain. This project grew out of the Improving Pain in Saskatchewan Collaborative Research Project, in which we are aiming to bring people together to share information and plan action to improve how pain is managed in our province. So the Improving Pain in Saskatchewan research team partnered with SaskPain, a nonprofit organization, to offer this program, and funding for Partners in Pain is generously provided by a Saskatchewan Community Initiatives Fund grant, and we are very grateful for their support. And just a few reminders before I introduce our first speaker. I'm very excited to hear him speak, but just remember to keep yourself muted during the presentations in order to minimize any background noise. And we're certainly happy to see all of your faces. So if you're comfortable doing so, please turn your video on. I know as a speaker, I always appreciate being able to see people's faces and reactions. Otherwise, I just feel like I'm laughing at my own jokes, which is kind of strange, but I'll do it anyway. So if you do feel comfortable, turn on your camera, wave, say hello. You know, if you're having connection issues, it may just help to keep your video off. Or if you're working out or you don't want to eat in front of us or something like that, by all means, keep your camera off. But if you can, join with the camera too. So we will be having opportunities to ask questions during the session. So make sure that if you do have a question at any time, you can pop it into the chat, and I'll be sure to read those out when the time comes. And then we will also be inviting people to unmute themselves and ask questions live if they feel comfortable doing so. All right, so I am now going to introduce our distinguished speaker for the evening. So it's my pleasure to introduce you to Corey Young. And Corey has degrees, there he is. Hi, Corey, thanks again for joining. Corey has degrees in physical education and physical therapy from the University of Saskatchewan, and is a certified athletic therapist. And Corey worked with the U of S Athletics, Saskatoon Hilltops, and the Saskatoon Slam basketball teams as a trainer while attending university. And following university, Corey worked for the PA Raiders Hockey Club, and in 1998 was one of the founders of Pro Sport Rehab and Fitness, a multidisciplinary rehab clinic with locations in Saskatoon and Warman. And while practicing as a physical therapist, Corey acquired his certificate of acupuncture, his first responder certification, and certification in biomedical DryNeedling. He is a lifelong learner. Corey is a member in good standing with the Saskatchewan Sport Medicine and Science Council, and continues to practice as a physical therapist with Pro Sport Rehab and Fitness. So thank you again, Corey. We are looking forward to your presentation, and you can go ahead and load up whatever you need to load up and share your information. Thank you.
Excellent. Okay. Everyone can see that, I hope. Celine, is everything good? Okay. All right. Well, thanks for the introduction. And I always, the more talks I give, the longer this introduction gets, to realize how long I have been doing this. So I'm getting a little aged and gray on the sides, but that's all right. And again, of course, a thank you to all of you for listening today. And I hopefully you find this information on how dry needling can help with pain control. Again, just to expand slightly from my needling background, like Susan said, I received my certificate in acupuncture in 2006. And we were just introduced to the concept of dry needling and acupuncture. That's called ashi pointing. And ashi in Chinese means ouch. And as we go through the talk, we'll talk a little bit more about why dry needling is called ouch pointing. And then in 2020, after a couple of COVID delays, like everyone else's life, I did get my certificate in dry needling. So I'm going to cover a few things today that I was asked to talk about. We're going to talk, there are different types of dry needling out there. So we'll try and differentiate that for you. Some basic pain science, which I'm sure most of you are well versed in, how dry needling would actually work, what can you be expecting in a dry needling session, and how does it differ from acupuncture? And then finally, and probably most importantly, is where should you look, or where can you find a dry needling practitioner in your community? Just as a point, the majority of this information from dry needling obviously comes from my Trigger Point Dry Needling course. It's run by Scott Gallant, so it's not all marked, but that's where most of it comes from. So first off, dry needling. So basically, what is it? You get a lot of questions on that. So it's any technique that uses a solid filament needle to be inserted into the muscle of the body for therapeutic purpose. The reason why it's considered dry is because the needle is solid, so you can't inject fluid or you can't draw out blood with these needles. So any muscle of the body can be dry needle, but there are some parts of the body that you have to be a little extra cautious because there's potential to cause damage if you needle improperly to the internal structure, such as if you're over the lung, over the viscera, like the abdomen, if you hit nerves or blood vessels. So the term dry needling technically would apply to acupuncture, but in therapeutic sense, dry needling just refers to any non-acupuncture application of your needles. So there's a few different types. Intramuscular stim, which is the most commonly practiced dry needling technique out there. And that includes the trigger point dry needling. And again, that's what I was certified in. And this is where using the needle to stimulate the muscle. And what we're really looking for is to cause a twitch on the trigger point. And I will explain that a little deeper later. But it also can include just deep dry needling. So you can't really see the muscle, you can't see the twitch, but now we're inserting the needle deep into the muscles, like in the hip, would be a good example of that. There is a technique called periosteal pecking, which is as bad as it sounds. So you take the needle and you actually use it to scratch the covering of the bone. And this, by scratching this periosteum, it stimulates the healing or promotes some pain response for joint pain. It's not a technique I've used or know much more about it, but again, you may hear about that. There is superficial needling, and this is when we use the needle to stimulate the muscle above the level of the trigger point. So again, you won't get that twitch elicited, but it can still have an effect. And then finally, intramuscular electric stimulation. So once the needle is in place, you can actually add electrical stimulation on the needle, and it can decrease the pain by using electricity to stimulate and activate a different pain modulation system of the nervous system than what we're going to talk about for trigger point dry needling. It's just a little different system, and I'm not going to go much into the depth of that. We'll stick with trigger point dry needling. Okay, so why are we all here? Well, it's pain. And like I said, from having gone through this course, Partners in Pain, I'm sure most of you have a good explanation of what pain is. So I'm not going to go in deep depth into the science of it, but just going to highlight a few points so we can connect the dots between pain and how dry needling could actually work. So first off, so pain, again, it's an unpleasant sensory and emotional experience associated with actual or potential tissue damage. And it can be described in such terms as that damage. So obviously you feel pain because something damaged you, or sometimes you can even feel pain before the damage occurs because you're expecting it. Pain involves the peripheral tissues, nerves, the spinal cord, and the brain. And it's obviously very complex with many components linking all this together. And again, we could spend a whole talk just on the pain pathways, and we're not going to do that today. Now, usually with acute pain, the body uses pain as a protective mechanism. So it's a good thing. However, with chronic pain, it becomes pathological in its sense. And so what that means is now it's no longer protective. Normal stimulation is felt as pain, and the system no longer functions properly. And this happens for kind of two usual or most common things. You can either have peripheral sensitization, and that's where there's increased sensitivity of the peripheral sensory neurons. So that's the neurons in the skin, the muscles, the fascia, and the joint. And those neurons transfer input from the periphery to the central nervous system, which is the spinal cord and the brain. So basically, with chronic pain and you get peripheral sensitization, this means now that non-painful stimulus to the periphery is sent as pain to the central nervous system. And I want to make it clear, it's not that it's not pain. The body totally identifies and it is felt as pain, but it's disproportionate to what really is happening on the periphery. Also with chronic pain, you can get central sensitization. And this is where there's increase in the excitability of the neurons in the central nervous system, again, the spinal cord and the brain. So that normal input begins to produce abnormal responses from the brain and spinal cord. So again, so non-pain stimulus from the periphery is identified as pain either by the spinal cord or the brain, and now that brain reacts to it and sends a pain response back down through the system. So those are kind of the two things that can happen when you have chronic pain that will increase your sensitization of pain, and so we want to try and stop that. How dry needling actually works. First, with just a little definition, because I learned trigger point dry needling, so everyone wants to know what actual trigger point is. So the very technical term, it's a hyper-irritable spot in the skeletal muscle that are associated with a hypersensitive palpable nodule in a taut band. And now that's all clear, I'm sure. But if it's not, when you have a tight muscle and you can feel a bump or a knot in your trap, that's basically your trigger point. It's just that area of super sensitive, tightened knot in your muscle. Now, trigger points, why are they bad? Well, they can cause an energy crisis in the system. So now the muscle is working too hard, and you get a buildup of chemical imbalances, and it reduces oxygenation of the tissue. Again, that can cause pain, again, more hypersensitivity and tightness in the muscle. Trigger points can be identified a few different ways. They can be an active trigger point, and those are ones you feel all the time. And again, if you have that one tight spot in a muscle that never goes away, that's an active trigger point. They can be latent, where you only feel them during activity, or if you really get in there and really massage, you can find them. They can be a primary point, that's developed through the overuse. They can be secondary, and it's a little bit, so they develop in a muscle that works opposite to the muscle which already has the primary trigger point. So you can start getting series of these trigger points just because of one area of soreness. And then finally, there might be a satellite, which is it develops in an area of referred pain. So as you can see on the diagram there, there's a trigger point, and then it gets referred off to the other one. And now you have a trigger point in another muscle, so we can hit our target more than one spot. Now, it's important also to realize that trigger points occur in both acute and chronic pain. This is not just a chronic pain situation. Any pain can cause a trigger point. It just, the longer it's there, the more you have, you just may develop more and more trigger points. So dry needling is not just a chronic pain thing. You can use it for both. So how does it work? Well, dry needling decreases pain messages sent from the periphery and decreases peripheral sensitization in chronic pain. So this decreases the pain stimulus sent from the periphery up to the spinal cord and brain. So basically, how is this done? So with acute pain, the dry needle will actually go in and stimulate the peripheral pain sensing neurons. And then this sends a non-pain stimulus to the central nervous system. So basically, what we're saying is that the needle itself just becomes the message. The neurons now say, hey, there's a needle in me. It's not causing pain, but this now reduces the ability of the nerve to send the pain message up to CNS. And that's the gate control theory of pain, if you're familiar with that. In chronic pain, on top of what we just talked about, we get those trigger points. So once the target muscle is identified and needled, and the trigger point twitches, that muscle tone normalizes and allows for normal neurochemical function of the muscle in the pain system. Again, decrease the peripheral sensitivity. So now, abnormal pain stimulus is not transmitted from the periphery to the CNS. You don't have that hypersensitive peripheral system telling that light touch or something is now painful to the spinal cord and brain. It's just telling its information that's normal. Hopefully that made some sense. Dry needle can also decrease central sensitization. So this decreases the pain stimulus to be sent from the spinal cord up to the brain, and then it decreases that pain response that comes back down through the system. So just to help it along, a little definition of a facilitated segment and chronic pain. So this is a hypermobile area of the spine, and when there's chronic abnormal input into the spinal cord, this segment can create referred pain, tenderness, and increased tone in the periphery. So again, because the spinal cord's not working properly, it's sending messages back down, you're getting these trigger points and pain out in the periphery. So when that happens again, so normal stimulus from this periphery sent to the spinal cord tells the brain that it's pain, and then it sends this all back down. So dry needling can normalize the muscle tone around that facilitated segment in the spinal cord, and that allows now for appropriate sensory information from the periphery to be sent by the spinal cord to the brain, and then also reduces the abnormal pain response back down the system. So again, it's really about resetting the neural tone so that appropriate information comes from the periphery, gets interpreted right at the spinal cord, gets sent to the brain, and then the brain now doesn't overreact to the pain and cause more pain and discomfort. So it's just a suppression of the whole neural system. So you feel pain when you're supposed to, but you don't feel pain when you're not supposed to. Now, as well, as we talked about, it can be used for acute pain. So dry needling near the spine can also just increase pain modulating chemicals to be released from the spinal cord to reduce that normal acute peripheral tone. So just keep in mind, it's not just an acute pain technique. That's always the kind of the dry part, the science behind it. That hopefully made it somewhat make sense. So we'll go into more now, what to expect if you actually go for dry needling. And I will just kind of mention that, keep in mind, this is based on my experience as a physical therapist providing trigger point dry needling. There may be slight differences if you see an alternate practitioner like an acupuncturist, a chiropractor, or a medical doctor, but the basic principles should still be the same. There might be just little differences. So first, when you're going for dry needling, the practitioner should get informed consent from you. They should describe the needling process. They should tell you where the needling will occur, how it'll help your case as part of the treatment program. And they're also going to explain the contraindications, risks, and what to expect from it. So I thought I'd covered some of those things, just in case you're wondering, am I a candidate for it? So there are some dry needling absolute contraindications. These are people we just would not needle. So if you have a very high sensitivity to needles or needle phobia, we just wouldn't go ahead. And I've had a few of those in my career that they've just, I just can't do it. I just cannot handle you putting needles in me. So we find an alternate route. Patients who don't give consent, now either they're unable to, they're minors, and so they can't give consent without their parent, or if they're just in a, where they cognitively not aware, can't make that right consent choice, we won't go forward with that. If the patient is medically unstable, obviously. Now, most times in a physical therapy setting in private practice, we won't be getting people in really poor medical condition, but if someone's just not in a good state, we're not going to add more input to their system by needling these people. And if you have an area of lymphedema or local infection, we don't want to needle that area. You don't want to increase the lymphedema or spread the infection. There are what we call relative contraindications. So these depend on your practitioner's skill and also just the patient's comfort if the technique is going to continue. So there are some things out there that can cause some abnormal bleeding. This can come from a medical condition or even just on certain medications that will increase your risk to bleed more. So again, we can still needle those people, but the practitioner has to know that, so to be very aware, that if we hit a blood vessel, there could be increased bleeding. And then we would usually just limit the number of needles. But again, it'd be a conversation to make sure both people are confident with what's going on. If you have a compromised immune system, there's always a slight risk of infection when you ever enter anything into the body. So if you have a compromised immune system and you don't feel comfortable with an infection happening, again, that's a conversation you want to have. If you have vascular disease, as I mentioned a few times, there's a chance we may hit a blood vessel. So if there's any vascular disease, you want to be aware, if there's any other risk associated with this. Diabetes reduces your ability to, your peripheral neuropathies, you don't feel as well in the periphery, and your circulation is different. So again, you may not feel if they're hitting something not supposed to. So again, just having that conversation of, is it still something you're comfortable going ahead with? And is the practitioner, comfortable going ahead with the needling? Pregnancy. Pregnancy is one of the things that it's much like most things. No one really wants to test if it could be doing anything wrong, but there's just a small risk that you could cause some problems in the pregnancy. So for the most part, the courses I go to, they will pretty much say just stay away from needling pregnant people. If you go to acupuncture, again, a different situation, very experienced acupuncturists will go ahead and acupuncture pregnant people and do some dry needling. But again, that's where you get into the skill of the practitioner and having a good conversation. And finally, there are a few people who are allergic to needles out there. They're made of metal. If you have any needles to earrings or rings or anything, you may be allergic to the needle. Now, for the most part, it's nothing severe. Usually you get like a mosquito bite bump, but it can be itchy and uncomfortable. So again, you just want to make sure you see how allergic you are if you want to go ahead with that. Some side effects you're going to feel? There's often post-treatment soreness. And this can last 12 to 24 hours, and it really feels like a hard workout. Or if, sometimes if you've been punched in the arm, you get that next day's soreness. Again, bruising or bleeding is a somewhat common experience. We're going to eventually hit a blood vessel. Fainting's rare. Only 2% of the documented cases do people faint, but it can happen. It's happened to me once. And most time though, you might feel a little drowsy or fatigued after treatment. Next, the preparation, physical preparation. So the practitioner will have you lay down in a comfortable position that allows for appropriate needle positioning as well. The skin should be cleaned always, obviously. Now, disinfection is not mandatory. There's debate in the literature whether you should or shouldn't do it, but it is suggested. Same thing with gloves with the practitioner. Again, it's not a mandatory thing, but it's suggested just for sterility. Next, they should make you aware that the needling is about to happen. So what does the actual needling happen? Well, the target tissue or the trigger point of the muscle in the area to be needled will be identified. And usually we do that just by palpating and feeling the muscle. And we're looking for that area of increased tone. The muscle will be secured by a flatter pinch grip. So you can see the practitioner's hand on that person. So that's a flat grip. They're just making sure the muscle's where it needs to be to ensure that proper needle placement. There's a guide tube that surrounds the needle, and Celine, after I'm done here, is going to show a video which is going to show this all in one kind of continuous thing. So you'll see what a guide tube looks like. But the guide tube is placed against the skin, the needle's tapped, the guide tube is removed, and then the therapist inserts the needle to the specified depth or to the specified muscle. Now, usually once the needle is there, they'll piston it or plunge it, which is an up and down motion with the needle, because we're trying to hit that trigger point, and sometimes it takes a little bit of different angling to find the trigger point. Or they may use that needle at that point to scrape the periosteum, like I said. And again, or it may be just left in place and they may add electric current to it. For the trigger point dry needling therapist, once we elicit that twitch, and that twitch is that sudden small twitch or spasm with pain. Again, coming back to that ouch point. The therapist, usually we see the twitch, and again, you see the video, you'll actually see the twitch, and the patient usually lets you know when you hit it because it's kind of a sharp, uncomfortable sensation. But that pain goes away right away. The needle is removed and disposed of per biohazard guidelines using a sharps container, and pressure will be applied to the area for bleeding prevention, cotton ball or swab, or even just by your finger. If other sites need to be needled, the process is just repeated. As I mentioned earlier, that oftentimes with pain, you'll have more than one trigger point. So they may hit more than one trigger point in the same muscle, or they may go to an opposite muscle or a referred pain muscle. And just remember that dry needling is really not a standalone process. It should be part of a treatment plan. And if you're in chronic pain, I know you guys are all going through a bunch of things, and just remember this isn't the be all end all, but it should be used as part of a technique. And so if you're seeing a practitioner, they may involve other things at this point. They may do manipulation, mobilization, they may stretch, give you some exercise, education. All right. What's the difference between trigger point dry needling and acupuncture? Well, first off, certification. So these are not the same treatments, and being certified in one does not automatically certify you in both. Now, advanced acupuncturists are often trained in dry needling, but dry needling courses do not certify you in acupuncture. So acupuncture uses multiple needles inserted to a specific depth at a specific angle to very specific acupuncture points around the body. You can see from the diagram there that there's every one of those spots, and those are standard. Those are the ones you have to hit those points. Where dry needling, you just go to wherever the muscle takes you. Once the needle is there, the needle can have just a local effect on the tissue near the needle, or systemic effect on the whole body. And with acupuncture, we're still looking for pain control, relaxation, inflammation control. Now, whether it's a local or systemic effect is just dependent on the acupuncture point. And that's, again, the Chinese have identified those over the years. The needles are left in the body, which is, again, different from trigger point dry needling, for a period of time. It can be anywhere from 15 to 45 minutes, depending on where you're going and how long your appointment is. It can be manually tapped or twirled, or acupuncturists will also put electric current on it. Now, how the acupuncture actually works, again, is different than what we talked about earlier. It's described two different ways. If you take traditional Chinese medicine acupuncture, they believe there's an energy or qi that flows throughout the body in very specific meridians. If there's a disruption of this qi where it can't flow through these channels and meridians, and that's those fine little lines you can see on the diagram, there's dysfunction or injury. So acupuncture is used to restore the qi. It's like using a key on a gate just to open up the channel so the qi can flow. And if once the qi is flowing normally, it should allow for healing or normalized function. Now, anatomic acupuncture is the more modern medicine approach. And what they have found is they've noted that each acupuncture point that Chinese have found or identified sits near a nerve structure. And the needle is now stimulating the body's nervous system to encourage that natural healing response, pain control, inflammation control. And the big catchphrase, they say, it allows the body to normalize itself. So it's still using nerves, but just a slightly different pathway. Where can you find a dry needling practitioner, and what should you be asking? Well, good news about today's world, most dry needling practitioners will be identified on physiotherapy, chiropractor, acupuncturist websites. So you can do a Google search and it'll bring up a number of very reputable clinics and practitioners. Just remember though that licensed practitioners can't offer dry needling service unless they're certified through the professional's governing body. So if you're going to choose a location and it's not clearly stated on their website that you're seeing a certified dry needlist or a certified acupuncturist, just make that extra call and make sure that they've been certified and that they're in good standing with their body before scheduling that appointment. There's a number of them in Saskatoon. And if you're in a smaller community, it gets a little tougher. But again, like I said, either you're acupuncturist or physical therapist. There are some doctors who do it. It's rare, but go ahead and just check through those situations. So before the questions, just remember, my final point that dry needling really is a part of a treatment plan. It's not a standalone, and you should use it as part of that, involve it or include it in the different things you're doing to get to pain control. And I'll let Celine show that video, and then I'll answer questions.
Okay, so we're going to do a demonstration of dry needling on this patient's upper trap. First, I wanted to show you guys the different size needles. This is a 60, so it's a little bit larger than the 50, and then this is a 30 millimeter. The choice of the size or length of the needle and diameter of the needle depends on the muscle you're doing, depends on the patient. For the most part, I use a 30 by 50 and has pretty good results with that. There's different brands of needles out there. So we already have her prepared, so usually we'll swab the area a little bit. There's not much research showing that that's going to be any more effective as far as decreasing bacteria in the area. But let's just say that that's been done. Gloves are on. And what we're going to do is palpate for trigger points. So you want to understand the muscle that you're going after. You're going to be kind of parallel to the muscle, and then you're going to palpate perpendicular. Okay? And you're basically looking for a taut band, and then you're going to look for that hyper irritable spot, which kind of feels like a marble or even the size of a pinhead. As you get good at palpating for trigger points, you'll be able to feel that. Now with the upper trap, I'm actually going to kind of grab the muscle because I'm going to be needling towards my hand, my fingers on the bottom. So I know that I'm completely on muscle right now. I'm going to try and trap that trigger point right between my fingers. Okay. And now I'm going to put the tube directly on the skin, push down a little bit, and then it's just a quick tap. And if you push down enough and tap quick enough, she's not really going to feel the insertion of that needle. Okay? So now the motion is kind of a pecking motion, in and out, or pistoning motion. And we're looking for what's called a local twitch response. So hopefully you'll be able to see this on the video as we get to the twitch. She's getting full body twitches. So we try to do kind of in a clockwise fashion. If you want to redirect the needle, you got to pull it out between the skin and fascia and then redirect and then go back in. The idea is to get rid of as many of the twitches in the area as possible. You don't want to just go in and do one twitch. Okay? You pull out and you apply what's called hemostasis, and that prevents any bleeding. And as you'll see, there's no blood at all involved.
Perfect. So that's a good description, and sounds like we talked together about that. But Celine just got that off the internet, so she picked it. It was a great video to totally illustrate the things I highlighted today. So if anyone has any questions,
Sorry, that was excellent.
thanks, Susan.
If you have any questions, please pop them into the chat. Okay, I see one question from Curtis. How long is a session?
So the session is, like I said, usually as a physical therapist, you're going to get a 20-minute or half an hour appointment. The dry needling itself doesn't take very long. What you saw in the video, he dry needled that trap. And if that's the only trigger point, that's going to be the length of time for the dry needling. It may be minutes. We may hit at 1 or 2 other points. So maybe, 3 to 5 minutes. And then, like I said, the rest of the appointment will be the education, the exercise, the mobilization, whatever other things you want to do for a physiotherapy treatment. Chiros, they usually have a little shorter treatments. Acupuncturists usually have a little longer, and they may just do an acupuncture treatment as well. So you're looking more, the appointment will be dependent on what practitioner you're seeing, but the actual dry needling is going to be, 3 to 5 minutes probably.
All right. If anybody else has any questions, pop them in. I've got a couple while people are waiting. Oh, Don asked, how does a therapist determine the size of the needle and what is happening in treatment when you end up bruising?
Okay, so the size of the needle is based usually on is 2 things. Number 1 is the depth of how deep the muscle is. So like I said, if you're going into the hip, you're going to want a longer one. He had mentioned a 50. There's actually a 75, and there's 75 millimeter, 50 millimeter, and the first number he said 30 is like 0.3 of a millimeter. So the length is dependent on where the target tissue is, and if you're doing a very superficial muscle, you'll go with a shorter needle. The second thing is the width of the needle. So you can get very fine needles, and when you're trying to insert a fine needle into a trigger point, it will often bend and not go in very well. So a trigger point needle is usually a little thicker. I use, for my acupuncture, a 0.25 for thickness. For dry needling, we use a 0.30. So it's just a little thicker, and it's more just to allow that better, good penetration through the tissue so it won't bend.
Okay.
Oh, and the bruising. And the bruising, like I said, sooner or later, we're going to hit a blood vessel. So as he mentioned, you saw he put the thumb there. So if we stop the blood from coming out of the tissue, the blood is going to pool underneath the skin, and you're going to get a small bruise, and that is not uncommon. It's usually about the size of a thumbnail, so not very big, but we've just hit a blood vessel that's underneath the skin.
And I assume that's okay.
Yeah.
Part of the treatment. Okay.
Yeah, and that's what we talk about. If you're, if you have, hemophilia, or you're on blood thinners, that's going to increase that bleeding. And so we would tend to use less needles, not do as much, maybe do 1 or 2 trigger points only, just to decrease the amount of bruising.
All right. Curtis also asked, are there any clinics in Regina that offer?
I am not from Regina. I'm in Saskatoon, but I do know there's multiple physio clinics, and I know there's some therapists there who do dry needling, but I couldn't name one off the top of my head, but I'm sure most of them will have a dry needling practitioner there. I don't know. Susan, do you know any?
Not off the top of my head, no, but the Saskatchewan, is it the Saskatchewan Physiotherapy Association has a directory that you can search, and they do have, you can look for dry needling practitioners in Regina. So by skills or by services offered. So Linda asks, why not people with autoimmune conditions?
Okay, autoimmune, again, now with autoimmune, we don't want to have a risk of infection because your body is having tough time fighting it. It's a very small risk, but we are puncturing the skin with a needle. Whenever you enter something into the body, there is a risk that you could bring in bacteria or dirt that causes an infection. So you just wouldn't want to create a problem to someone who's already has some autoimmune issues. You don't want to give them an extra problem by the treatment that's supposed to be making them feel better.
All right. And Kathy asked if there is an order to treatments that should be followed. So does the sequence matter? Would you do the dry needling last, for example?
That's therapist dependent, and that comes just down to their comfort level where they're at. I would tend to use it near the end of a treatment just because there is a little bit of discomfort with it, and you're going to feel a little achy. So if I wanted you to do some exercise or had to mobilize, I would probably want to do that first. Unless that tight muscle is just preventing us from going anywhere, then you might have to do it first, but there's no set in stone. It's just be therapist preference. Great,
thanks. And Gail mentioned Courtside Physio has a dry needling practitioner. Janelle is her first name. So thanks, Gail. And Dawn asks, what is the what is the best way to keep muscles from pinching on a nerve on a regular basis?
The best way to keep muscles from, well, the best way is to keep their tone normalized. So first, and we always say like the treatment, the dry needling stuff, these are all short-term things. Usually if a muscle is getting tight and pressure, it's usually not strong enough. So it comes back to doing the exercises that go along with it. Doing a good stretching, strengthening program is the best way for long-term. The dry needling or stim or acupuncture is just those short-term reliefs.
Great. And I don't see any other questions, but I have one.
Okay.
How many sessions would you recommend for, say, for that woman whose trap was being done if she had some chronic pain in her neck and shoulders?
Yeah. Again, we're hoping that, it's always hard to say. Dry needling, you probably want to do 3 or 4 just to get that tone corrected, because at the same time, like I said, they're doing the other things. And as their strength builds up or they stop the poor movement pattern, then those trigger points shouldn't keep happening and you shouldn't have to do them anymore. But you could probably expect 3 or 4 dry needling sessions in a treatment program.
Okay, great. Thank you. Does anybody else have any other questions? I have one more. You mentioned that people can be a little bit achy or tired after the treatment. And do you have a sense of how long that typically lasts?
The fatigue is usually that day. The achiness can last a good day, like 24 hours, and sometimes a little longer. And it does kind of feel like if, the first time you work out, the next day you're stiff and sore. It can be quite a pronounced stiffness and soreness. But after that stiffness and soreness goes away, you do feel quite a bit better.
Great. All right. Last chance for questions. All right. Okay. Well, thank you very much, Corey. That was really informative, packed full of really good information, and I appreciate you sharing with us. So we are now going to move on to our second session. Oh, I see. Sorry, one other point. Gail asked, would ice on the area post-treatment help? Great question.
Ice would be counterintuitive, because what we're trying to do is get that muscle to relax and get the blood flow normalized. And when you put ice on something, it's going to contract the tissue. So it would probably help a bit with the soreness, but it would be counterintuitive to helping what we were trying to do with the treatment. So I wouldn't suggest you'd use ice heat.
Okay, great. Excellent. Okay, thanks so much, Corey, for answering the questions too. That was fantastic. So all right, so our next presenter is actually a pre-recorded video, and we've had Tracey teach us before, and she's going to be leading a session in qi-gong that you can follow along with, or you can watch and maybe think about doing it later. So Tracey, just to introduce our presenter, Tracey is a graduate from the University of Saskatchewan, and she has a Bachelor of Science degree in kinesiology and a master's degree in physical therapy. And since 2015, she's been working as a physiotherapist in her home community of Melfort, where she encourages individuals living with persistent pain to step out of their comfort zone and be an active participant in their healing. And Tracey has lived with persistent pain herself for over 10 years and knows firsthand how important physical activity is in her own pain journey. And you can find Tracey at the swimming pool, swimming laps, walking around town with her fiance, or spending some much needed time with her piano.
Hi again, everyone. I'm going to guide you through a qi-gong routine, which may be new to many of you. Slow, controlled movement with breathing is extremely beneficial for our nervous systems. This can be done in standing, or it can be done in sitting if you feel more comfortable. I also need to thank Carolyn Van Dyken for giving us permission to use this audio. Let's get started.
Breathing qigong uses imagery and gentle, relaxed movement to retrain the connection between sensation and movement in the upper back, diaphragm, abdomen, and pelvic floor. As with all qigong exercises, please go at a comfortable pace for you, listening to and incorporating the described imagery into your practice to help retrain the maps in your brain. To begin, close your eyes if it feels safe for you to do so. Stand with your arms hanging loosely by your side in a comfortable, relaxed position. Take some slow, deep breaths and just notice how your body feels. Notice any areas of tension or tightness. Notice any areas of lightness or relaxation. Try lifting your left arm over your head and lower it down. Does the left arm feel light or heavy? Switch arms and lift your right arm overhead and then lower it slowly. Does that feel different than the left side? Notice if your shoulders are lifted up towards your ears or lowered in a relaxed position. Are your feet relaxed or tense? How is your overall posture? Great job. Now open your eyes and let's start the exercises. The first exercise is called Great Bear Swimming. It is designed to open the chest and upper back. Start by taking a deep, slow breath in. As you exhale, round the upper back and reach forward with both arms as if doing a breaststroke. Place the back of your hands together when your arms are extended in front of you. Now, inhale and spiral the arms back and behind you as if you are swimming, pulling the imaginary water back with your hands. As you exhale, sink your chest again and relax the upper back, extending the arms forward again. As you inhale, feel the chest expand by drawing the shoulder blades together. This is a great way to open the chest and deepen the breath naturally. It also mobilizes the upper back in a gentle way. Breathe deeply as you spiral the arm backwards. Feel the body open. Feel as though you are swimming through a gentle, warm pool. Your arms are gliding back and forth through the water with ease and relaxation. Imagine the warm water flowing gently over your arms as they extend and spiral. This movement washes away any tension in your arms and chest. Excellent. The second exercise is deep abdominal breathing exercise called the wave. Bring both of your hands together over the lower abdomen. Focus the breath down into your lower belly. As you breathe in, feel the abdomen expand, and as you breathe out, feel your belly fully relax again, softening and letting go. Keep breathing smoothly in and out, noticing how your body moves with the breath. Now take your left hand and place it over your chest. With your next breath, bring the breath into the lower abdomen first, letting the breath rise up through the rib cage and into the chest as you make your breath longer and smoother. Notice the lift of your chest with your left hand. As you exhale, let the breath escape from the chest first, then release the breath through the rib cage and last from the lower abdomen. Notice these areas by observing with your hands how the breath moves through the different regions as you breathe in and out. Noticing the movement of the breath through the body helps to clear stress and tension. It also helps to restore energy to the internal organs by massaging them with the longer, slower, smoother breath. Feel as though the breath is massaging the internal organs, kneading out any tension or stress as you continue with the wave breathing. Now let's change the position of your hands during the wave breathing. Place both hands in front of your body like you're holding a large imaginary therapy ball against your abdomen. Continue that same wave breathing from the lower abdomen up into the chest. However, now I want you to synchronize the breath with a slightly different flowing arm movement. As you inhale, draw the arms up over your head, and on the exhale, let the arms gently float back down towards the lower abdomen. Float the arms up as you breathe in, hugging the imaginary ball, and let them fall smoothly back towards the lower abdomen during the breath out. Feel as though white, fluffy clouds lift your arms up as you breathe in. Feel how your whole body relaxes with this gentle movement. With each breath, see if you can relax just a little bit more. At the top of the breath in, allow the breath to pause just for a moment. At the bottom of the breath out, also allow the breath to pause. In this moment, allow your mind to be completely blank and totally relaxed. These micro meditations will help you to let yourself go, giving into the relaxation of the breath. Now float your arms back down to your sides again. Well done. The next exercise is a breathing exercise called the accordion. With both hands over the lower abdomen, gently press one arm up overhead while pressing the other hand down towards the floor. Switch arm positions by gently lowering the upper arm down towards the ground and raising the lower arm overhead. Keep doing this gentle transition between the arms, allowing the breath to move your arms. As you inhale, your arms move away from each other in opposite directions. And as you exhale, bring the hands closer together over the midline of the belly as your arms switch directions. Inhale as you separate your hands in opposite directions again. Imagine your arms are like a large accordion. The accordion opens with the inhale and closes with the exhale, blowing all the air out of the accordion. If you want an extra stretch during this exercise, you can add a little side bend while the arms are pressed in the fully open position. Stretch in the opposite direction from the upward reaching hand. This, along with the breath in, will help to create more space between the rib cage, allowing you to take deeper, easier breaths. Only do this progression if your breathing is easy and if it feels comfortable to do so. Don't force the movement if it is painful. Inhale, feeling the chest inflate, supported by the length of the arms, making your body as long as possible. Good. Now as you breathe out, let the air come out of the accordion, relaxing fully. Take a couple more deep breaths, pressing the arms lightly in opposite directions. Feel the breath running through your body, and then float your arms back down by your side. The last exercise is called Bamboo in the Wind. This exercise is designed to help you move with your entire body, with relaxation and ease, while staying focused on relaxed breathing at the same time. Take your hands and gently fold them over your lower belly. Close your eyes if it is safe for you to do so, and just imagine that you are a tall reed of bamboo, gently being blown back and forth by the breeze. Feel the warm air blowing over your skin in every direction. swaying you gently from your rooted feet. Allow your body to move gently back and forth, side to side, or maybe even in slow, relaxed circles. Relax into the movements, breathing deeply and fully as you let your body move in whatever direction feels comfortable with a gentle breeze. Good. Now let your body come to a resting position and remove your hands from your belly, letting them fall gently by your side. It is now time to do a consumer comparison. Close your eyes one last time if it feels safe for you to do so. Stand with your arms hanging loosely by your side in a comfortable, relaxed position. Take some slow, deep breaths and just notice how your body feels. Notice any areas of tension or tightness. Notice any areas of lightness or relaxation. Try lifting your left arm over your head and lower it down. Does the left arm feel light or heavy? Switch arms and lift your right arm overhead and then slowly lower it down. Does that feel different than the left side? Notice if your shoulders are lifted up towards your ears or lowered in a relaxed position. Are your feet relaxed or tense? How is your overall posture? Great job. Take these feelings of relaxed breathing into the rest of your day. Namaste.
Favorite kind of Zoom meeting is one where I can close my eyes and breathe deep and relax and hear a calm meditation. How did everybody feel with that? I'm ready for bed.
That was perfect after a hard workout.
Yeah.
I
that's great.
am a qi-gong practitioner. I've done for 3 years qi-gong in Spring Forest and wisdom healing qi-gong as well as tai chi. I just started. I really enjoy it. It's a great
Nice.
practice.
Is that something that you follow online, or is that a
Yeah,
class?
online. Everything's online.
Oh.
Nobody that teaches qigong locally, so it has to be online pretty much.
Yeah.
I wonder where she learned her.
Yeah. Would you be willing to share the link to that with us, Linda? Or is it a subscription that you pay for? or-
Spring Forest qigong is free online on Facebook every day of the week, 5
Nice.
days a week, and weekends too. They got a group, and it's free. So yeah, so Facebook. I'll see if I can get the link.
Yeah, that'd be great. Yeah, throw it into the chat if you can.
The screen,
That's great.
Screen down here.
Yeah.
Okay.
All right. I'm seeing people's comments, relaxing. Ooh, Dawn feels more tight and heat. I'm not sure if that's a good thing or not. More tight doesn't sound good. Heat, I'm not sure. Curtis enjoyed it. Dawn feels heavy. Yeah, I felt more heavy afterwards actually with the first arm raising, and then when she finished, it was like my arm just felt like a noodle afterwards, but I enjoyed it. So. All right, and Diane said that there are some qigong classes in Yorkton for people who live out in the Yorkton area. I haven't looked into it, so. All right, well, thanks everybody for sharing your experiences and for joining in the class. Oh, there, Linda, thank you.
That's the link, and it's 8 a.m. every morning, so 8 a.m.
All right, okay, thank you, that's great. And hopefully they have some recorded sessions that we can
Oh yeah,
find.
they have lots. They record everything, so it's on their Facebook page. You can go hear talks about qigong. You can, and it's a lot of good information on the website.
Great, thanks so much for sharing that. and we'll send that out when we email everybody tomorrow. I wanted to again reiterate my thanks to Corey and thanks to Tracey as well for sharing the pre-recorded video. I found it really interesting and informative, and I hope everybody who attended did as well. So yeah, and we'll be sharing the recording of the session on the SaskPain website, so you'll get to watch that again if you want to, and if you forgot everything that Corey said, it'll be there on the SaskPain website. You can hear him again. All right, so look for the email with the survey, and our next scheduled Partners in Pain event is March 2nd at 2 p.m. And the theme for that one is managing stressors associated with changes in health, something we can all benefit from. And once again, thank you very much, Corey, and thanks to Tracey for sharing her recording. And I hope everybody has a really enjoyable and relaxing evening.